Hi, this is Dr. Erica,
I'm Dr. Joe.
and we're going to go over the Voodoo band for ankle swelling. This is a mobility wand, aka the Ready State, and a Rogue Fitness band. You can buy this on roguefitness.com. But you can see that this is a stretchier band, and as you see, you can see that the mobility wand stretches out. And that's essentially what we want to do today as we apply this compression. This is for if you recently rolled your ankle or you're having some pain because of swelling. We're going to go over this technique today on the ankle.
So as Eric was saying, that you can use the letters to determine how much stretch that you're doing. So if you were to double it, then that would be 200% of the initial length of the band. So when you're wrapping, you want to make sure that you're trying to cover up all of the skin, and you want to have about a 50% stretch and a 50% overlap as you're continuing up their foot. So you're going to give a little bit of a, it's going to feel a little bit tight as you're doing this. It's going to be a little uncomfortable. But you want to make sure that you're wrapping towards the direction of the heart. If you'd wrap it the other way, you'd just be pushing the fluid back down their leg. So the back part of the heel is going to be a little bit difficult sometimes to wrap the band all the way around. You might have a little tiny gap back there, but that's okay. So 50% stretch, 50% overlap as we're continuing up. And then at the end, you can just let it loose like this, and then tuck the end in like that. And then what I'm going to do is I'm going to help her move her ankle through her range of motion. So I'm going to be pushing her toes up, or I'm sorry, her ankle up rather, just like this. And you want to go to the person's tolerance. So you want to watch for their pain face as they're doing this to see if they're having a little bit of a struggle. Now if they've just freshly injured their ankle, it's going to be a little bit uncomfortable, but if they have the residual swelling afterwards, or if it's been a few days, this is a good way to start pumping the fluid from their ankle back into their lymphatic system. So this is more of a natural way of trying to empty out some inflammation. And inflammation is not bad, it's actually a good thing. It's how your body heals, but you don't want to, you want to facilitate that and help it out a little bit. So as you're pushing this fluid through, it'll take a little bit of pressure off the joint, and it'll make it feel a little bit better for the person as well. So you don't want to leave this on for much more than maybe 2 minutes or so at a time. And then what I'll do is I'll take it off. And then you'd want to repeat this about 5 or 6 times and see how the person's tolerating it. You could always compare one ankle to the other side to see if you've made any difference. So we want you to go ahead and try that. Carrying one of these bands in your pack while you're hiking or while you're traveling, it's a really good thing to have. It's a good way to manage swelling on your